I'm Elijah Neal, and today my dad is going to be performing a cataract surgery. Let me just get my headset on. My headset, it's plugged into nothing. Oh my gosh. Nope, that's upside down. Is that good? Yeah, that's good. Okay. Hello? Okay, so I'm going to give you a quick run through. So there's going to be 2 incisions. One here, one here. He's going to be putting in antibiotics for this incision, and he's going to be doing a capsulorhexis in this incision. So after he does the capsulorhexis, he will be He will be using hydrodissection to loosen up the cataract. Then he will use.
My face hurts. Yeah, my face is hurting. Sorry.
Okay. He'll be using a phaco handpiece to sculpt a groove through the cataract. So right now he's using some tweezers to do the capsulorhexis. And after the capsulorhexis, after he gets the cataract out, he will be using a lens and putting a lens into it. And then he'll be done. Okay. Okay. So I'll kinda just pop in whenever he's doing something.
Will not have this thing figured out yet. Part of it could be like I'm so impatient. Like if I have to wait, I'll stomp around here looking cross, and they're like, "Well, we better not keep the guy waiting." That's probably my fault.
Well, I worked at a medical facility for so long that.
Yeah, really. So I guess you kind of know that it's kind of like that. No plan survives contact with the enemy. Just not to say that patients are the enemy. Maybe take that the way it's intended, not the way it sounded.
Right.
So a posterior polar.
Okay, now he's using his phaco handpiece to sculpt the cataract into 4 different quadrants, and then he will use it as a mini vacuum and suck the cataract out. Okay?
It's really a congenital defect in the posterior capsule. So you can have a cataract and a capsule, but it has like, if it doesn't have a frank opening, it can be really weak, or even like kind of like I've seen them with lots of little holes. Just kind of like micro perforations in the center of the capsule. So if you hydrodissect, it puts pressure on the posterior capsule and it'll just blow wide open, and then now you've dropped the lens. So
Can you tell that when you do your initial exam in the office?
well, sort of. I tend to like overcall them because I don't want that to happen. It seems like most of the time, like 90% of the time when I say no hydrodissection, it just looked like a posterior polar, or it was, but there were capsules totally normal, and I could have hydrodissected. But I've had a couple where there really was a pre-existing hole. I don't know, hydrodissection is one of those things that maybe it matters, but maybe it doesn't really matter. Like, we didn't hydro here and it seems just fine. Yeah. maybe I've been wasting my time hydrodissecting all these patients. But it's what they taught me to do. It's the way we're trained. Maybe I should just stop. Yeah, so her capsule's totally fine. It just looked that way. But it's better to be safe than sorry, right? Right. But I'm not really a rotator. But I think it does help get the capsule clean. See, if you look at this case, there is a fair amount of cortex still attached to the capsule, which if we had done the hydro, probably would. So, I mean, in that sense, maybe it makes the overall procedure more efficient to do it.
And I need to cough.
Oh, go ahead.
Oh, thank you
for telling us.
Yeah, I appreciate that.
Well, they warned me.
Yeah, sure. Let me know when you're ready to proceed.
Alrighty.
Okay. Yeah. You get an A+ for that. Thank you.
You're welcome.
We tell people, but then, we give them sedation. And they kind of drift off and forget where they are.
Oh, I can always tell when I'm going to cough.
Yeah. I had one today that took me, like 27 minutes. And just had the wiggles.
Okay, looks like he's put the lens in, he's just polishing off. So once he's done with this, he will be just putting in antibiotics and then he'll be done. Remember to like, share, and subscribe if this is interesting to you. Still a needle.
ESS actively make those clothes?
Yeah.
Just like filling space?
Well, we put it in the roof of the incision, so it swells up the roof. But, yeah. Exactly.
But it's not like the salt doesn't do anything.
No. It's just, if you use distilled water, it would hurt. So you just use saline because it's the same.
Okay, looks like he's just finished, so remember to like, share, and subscribe if you did enjoy, and we'll see you in a couple more minutes. Thank you for watching.